Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Senior Marketing Specialist Rachel Rom. In recognition of National Immunization Awareness Month, observed every year in August, we are excited to sit down with CompleteRx Transitional Leader Tim Crowley. Together with Tim, we discuss vaccine compliance and some of the options facilities can utilize to assure their communities continue to be vaccinated and to reach those who have yet to be vaccinated. So, welcome, Tim. Thanks for joining us in today's episode.
Thank you for having me, Rachel. It's always a pleasure to talk about vaccines and the impact that it has on our healthcare systems.
So this month, we're observing National Immunization Awareness Month. And I think we can both agree that with the recent spike in COVID cases and with the new numbers hospitals are reporting daily,
Mhm.
vaccination compliance, and not just specific to COVID, has never been more important.
Indeed, it is. Absolutely, Rachel. Considering, according to the CDC's latest statistics, that an astounding 83% of all new COVID 19 cases are the result of the Delta variant, and 95% of all the deaths recently are in those who are unvaccinated. There is clearly an important message about vaccine awareness that needs to be told. But also, being Vaccine Awareness Month, let's not forget uh, as a result of the outbreak of COVID 19, there's been a significant drop in childhood vaccine rates. Some alarming
Right.
examples of that: rotavirus is down almost 6%, pneumococcal vaccine is down 8%, Tdap 17%, diphtheria down 8.5%, HPV over 18% decrease, meningococcal vaccine down almost 14%.
Yeah, I mean, it's really eye-opening when you consider a decrease in those rates, especially since some of these have been around for a number of years. So, all this month, we've been sharing tools and resources to our network to help providers better communicate the importance of vaccination compliance with their communities. But one thing we haven't spoken about is the available methods hospitals and health systems have to actually get the communication out to the community. So let's talk about those methods. What do most facilities have, and how can they better utilize them if they aren't?
That's a great question, Rachel. Thought leaders need to utilize the existing and novel methods to assure their communities continue to be vaccinated and continue to reach out to those who have not.
Right.
I would first consider looking at your facility's inpatient population, and three ideas for me would come to mind. First, I think creating standing orders within a facility, which most of the facilities are already doing, which offer relevant vaccines to all patients. This
Mhm.
strategy has been successful in the past, especially around influenza and admission uh, orders when they're integrated as part of the newborn order and admission system in obstetrics as well.
Mhm.
Um, Secondly, electronic health reviews targeting at-risk patients or the use of criteria-based selection for inclusion, such as patients who smoke, those who are immune compromised, obese patients, or those who are diabetic. Those
Mhm.
those those uh, demographics are always susceptible and at risk for many diseases, not only just COVID.
Right.
And lastly, of course, through direct mailings or text messaging to get the word out to as many individuals as possible. And some other forward thinking strategies I was just thinking about for community based vaccine awareness would include adding buttons or banners to your facility's webpage. Just having those links where, get a code, learn more about COVID vaccines, and then having it hyperlink, sharing
Right.
posters and flyers in physician offices and community venues, and even sharing tweets and social media posts within the health system's virtual community
Right.
um, to reach especially the younger population who are underserved and undervaccinated at this point.
Mhm.
Um, the latter could be used to help dispel misconceptions as well, or myths created about vaccines and stress their importance in promoting wellness, and even in the case of COVID 19 moving toward normalcy.
Yeah, no, absolutely. It sounds like it's simply about ensuring a more proactive process, streamlining each step, and making it as easy as possible. But also really pushing out that message. So, meaning getting the entire organization on the same page, setting the protocols to make administration more efficient, then ensuring all clinicians are making a conscious effort to find those individuals that are in need and just really blasting it through any channels, like you said, the posters, the social media, the website, wherever those people are seeking information, blast it out, right?
Exactly. And you're not oversimplifying it at all. It's pretty simple. While the immunization structure in the United States is complex and multifaceted, the
Mhm.
goal is always to increase vaccination rates by improving and leveraging the elements that already exist, rather than creating new systems, programs, and entities which would consume further precious time and resources. So, whatever we have and whatever we can use, we certainly want to utilize all of those avenues.
Yeah, absolutely. Well, that's what we're doing here today. So thank you, Tim. I appreciate your time and your expertise. This is an extremely vital topic to discuss, especially at this time with the increase in numbers, the new variants changing daily or weekly. And, I'm really glad that we're arming our audience with solutions to get their communities vaxxed, right?
Yes, and it's so important, and it's always a pleasure. And thank you again for the opportunity to talk about this really important subject to me.
Absolutely. And, happy National Immunization Awareness Month. We're in it together, right?
We're in it to win it.
Awesome. Well, thanks, Tim.
Thank you.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.